Welcome to The Explainer. Today, we're diving straight into the incredibly intricate electrical wiring of your upper limb, the brachial plexus. We're drawing directly from foundational anatomical texts to really break down and demystify how this vital system operates. So get ready, because we are going to trace the biological power lines of the human body. So, have you ever actually stopped to think about how a signal from your brain flawlessly makes its way all the way down to your fingertips to pull off a really precise, fluid movement? Whether you're throwing a baseball, typing on a keyboard, or just brushing hair out of your face, your body is delivering a high-speed electrical command from your spinal cord right out to your arm and hand. But how does that happen without the signals just getting completely crossed? Well, the answer is all in the body's ultimate junction box, the brachial plexus. This is a highly complex nerve network formed by the anterior or ventral rami of the lower four cervical nerves and the first thoracic nerve. In anatomical shorthand, we just call that C5 through T1. Literally, every movement you make with your arm and every sensation you feel from your shoulder to your fingertips relies entirely on this specific cluster of nerves. Here is what we're covering today. 1. The body's electrical wiring. 2. Roots, trunks, divisions, cords. 3. The 5 major nerves. And 4. Nerve injuries and paralysis. Let's jump right into part 1, the body's electrical wiring.
Now, you might assume that the standard C5 to T1 setup is exactly the same for every single person, right? Well, not quite. Nature loves variations. If the plexus gets a large contribution from the C4 nerve, which is higher up in the neck, and nothing from T2, it's called a prefixed brachial plexus. On the flip side, if it leans heavily on T2 lower down and C4 is absent, it's considered postfixed. It's just a brilliant reminder that human anatomy is super dynamic and adaptable.
Moving on to section 2, roots, trunks, divisions, cords. It's amazing how this entire structure reorganizes itself as it travels. It starts as 5 distinct roots deep in the neck, they merge together, split apart right behind the clavicle, and finally rebundle into cords inside the axilla, or your armpit. It's a total engineering marvel of routing and rerouting, just to ensure every single muscle gets the exact nerve supply it needs. So the key takeaway here is this linear sequence: roots, trunks, divisions, and cords. If it helps, you can use the classic medical student mnemonic: remember to drink cold beverages. The 5 roots form 3 trunks: upper, middle, and lower. Behind the clavicle, each of those 3 trunks splits into an anterior and a posterior division. Then those divisions merge to form 3 cords: lateral, posterior, and medial. It's a beautifully organized system of convergence and divergence. There's a massive junction right on the upper trunk, known clinically as Erb's point. It's an intersection where a staggering 6 different nerves meet up. The 5th and 6th cervical roots join here to form the upper trunk, which then immediately gives off the suprascapular nerve and the nerve to the subclavius, before finally splitting into its anterior and posterior divisions. It is an incredibly dense amount of wiring packed into a really tiny anatomical space. Okay, let's head into section 3, the 5 major nerves. From those 3 cords we just broke down, the plexus branches out into 5 major terminal nerves. We've got the axillary nerve, the musculocutaneous nerve, the radial nerve, the median nerve, and the ulnar nerve. These are your 5 main power lines branching out to supply motor control and sensation to everything from your shoulder joint all the way down to your pinky. So who does what? Actually, try flexing your bicep right now. That is your musculocutaneous nerve firing, which is powered by the C5 through C7 roots. Meanwhile, your massive radial nerve, which is actually the largest nerve of the plexus, taking fibers from all the roots, C5 through T1, acts as the absolute workhorse for extending your elbow and wrist. The median nerve handles the flexors on the front of your forearm, while the ulnar nerve, often called the musician's nerve, powers most of the fine, intricate muscles in your hand. Which brings us to our final section, number 4, nerve injuries and paralysis. So, what actually happens when this perfectly organized system takes a hit? Let's compare the 2 most famous brachial plexus injuries. First up is Erb's paralysis, which is an upper plexus injury. This is usually caused by an excessive increase in the angle between the head and shoulder. Think of a fall from a horse where you land directly on your shoulder, tearing those C5 and 6 roots. On the other hand, we have Klumpsky's paralysis, a lower plexus injury. This happens from a sudden, violent upward pull of the arp, like grabbing a tree branch to stop a fall, which ends up tearing the lower C8 and T1 roots. Because completely different cables get cut, the physical outcomes are night and day. Erb's paralysis gives you that classic waiter's tip or policeman's tip deformity. The arm hangs adducted, medially rotated, and the form is extended and pronated. Klumpke's paralysis, however, knocks out the muscles of the hand, creating a severe claw hand. And crucially, because Klumpke's involves the T1 root, it also causes Horner syndrome. That includes a drooping eyelid and constricted pupil, all because of the involvement of sympathetic nerve fibers that leave the spinal cord at that exact level. All of this dense wiring is a huge deal for surgeons too. When operating in the axilla, for instance, excising lymph nodes during breast cancer treatment, surgeons have to deliberately safeguard the vital structures running through the space. They navigate extremely carefully around the long thoracic nerve, the intercostobrachial nerve, and the thoracodorsal nerve and artery, just to prevent lifelong functional loss for the patient. We've now traced these biological power lines all the way from the spine down to the fingertips. The next time you just reach out to grab your coffee, think about that crazy electrical storm firing perfectly through your brachial plexus to make that simple gesture happen. But it really leaves us with a profound question. If a simple slip of the shoulder can sever our physical connection to the world, just how much of our everyday human experience is hanging by a literal thread?